Namaskar. We
Namaskar.
would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series, and today in PTSR series, we have postnatal care, scientific relevance, and our keynote speaker of the day is Dr. Yamuna A, Associate Professor, Prasuti Tantra and Stri Rog Vibhag, Vishnu Ayurved College, Shornur, and she MSc in psychology also. She is postgraduate in yoga also. So she is multidimensional expert with us. We are very fortunate, and we are going to listen regarding post-delivery care, postnatal care according to Ayurvedic concepts and principles. I am really grateful to Professor Kamini Dhiman, Professor and HOD Department of SRPT, SAMCH, deemed to be University Vadodara. So welcome Dr. Yamuna,
Thank you,
welcome
sir.
on the platform, and I would like to welcome this. Actually, webinars and events are being planned for YouTube viewers. So please circulate YouTube link also. Now I would like to request Dr. Yamuna A for his kind blessings on the topic postnatal care scientific relevance. Welcome, madam.
Thank you, sir. Thank you for welcoming me and giving me an inspiration before the session.
You can share your PPT also if
Yes,
you have.
yes, sir. Yes, sir. Oh, visible, sir.
Yes, your screen is shared. Now
Okay,
you
sir.
can share your PPT.
Visible, sir. My PPT is visible, sir.
Not PPT, your screen is visible.
Screen is visible.
Your total screen is visible. Share the screen and open your
Yes,
PPT.
yes, yes, yes. Shared.
The screen. Yes. Again screen. Open the PPT. Yes, yes, yes.
Now, visible, sir.
Yes, visible. You can go. Yes, great, great.
Yes, sir. So, with the blessings, I'm starting the session, sir. Welcome all the participants. So today we are going to see what the postnatal care in Ayurveda and practically what we do, not itself the Ayurveda, what how we can deal a Sutika, a postnatal lady, with an integrative approach. Actually, as Ayurveda, we consider as a whole person, human as a whole. So there is no difference in modern technology or Ayurvedic concepts. So we consider the whole as a whole, the body, how we care a Sudhika, that is after delivery. We all know that there are different stages. especially ladies or women, body changes occurs in each and every uh, avasthas. Bala, Kaumara, up to Vardhika itself, lot of changes occurring in her body. So that changes is inevitable. So why that changes occurs? Because of her physique and the hormonal or the prakriti. We can say the prakriti. So to some extent, that change we can revert back, but not up to, as the uterus won't come to the previous position. That is, it's maybe the jara is a inevitable thing. So can be due to that her body. We can say that it will come back, but to some extent it won't come back. But our aim is to make her back, that is make her healthy and useful for the society, or make her health and make her body can be, or make her mind can be utilized for her further activities in the society or in the family, because her family or females are the strength of the family. So she forced to, or she has to come back from that avastha. So our aim is to boost physiologically. It comes back to the normal stage after the each stage, or especially after the pregnancy and delivery. But our Ayurveda and all the postnatal care in all the systems, making her healthy for further life. So the term we say Sudha, with Sudha or Sudhika, from the Sudha Dhatu, that is secreting or to come, to move, like that. So from that state, or from that word, we can say that the lady which delivered a baby, or delivered baby, we won't say only after the expulsion of the placenta. The lady delivered a baby or fetus only after the expulsion of the placenta, that is only after the third stage of the labor. After the third stage of the labor, we can say her as a, or we can term as a Sutika, with Sudha, Sutika. So secretions, or after the secretions, after the expulsion of the placenta, we can say her as Sutika. So that period, that Sutika, up to what stage, and up to what period we can say as a Sutika. The time up to which she revert back up to a maximum, revert back up to maximum reversion. So usually it is 45 days. All majority of her organs come back to her pre-pregnancy state. That is, but that is 45 days. We can say that, but Acharyas, Charaka Samhita has not mentioned properly, but Susruta Samhita, Bhava Pragasha, and Yogiratnagara, all the Acharyas, as Kashyapa Samhita, all Acharyas mentioned 1.5 months, Ashtanga Hridaya Vagbhada, 1.5 months, 4 months, 6 months, or till the appearance of Artava. This is as a whole I am saying, not specific. Specific. So in general, we can say that 6 months. So max 6 months takes, except a few organs uh, comes to the normal state, or comes to the pre-pregnancy state, maximum 6 months. So up to that month, we have to take her with ahara, vihara, and aushadha if needed. So she should take care properly till that period. So that period we can say that Sutika Kala. So Sutika Kala starts just after the delivery of the placenta till her organs revert back to the pre-pregnant state. But we can say, we can divide that period as acute phase, then early state, and the late state. The WHO and ICMR, all the current health systems, or everybody is accepting as it should be a person-centered, respectable postnatal care. So acute phase itself, that is 24 hours. 24 hours after the delivery of the placenta, that is a crucial period. We should observe her properly to prevent, especially to prevent many complications like postpartum hemorrhage, etc. That is why nowadays hospital-centered deliveries are promoted to take care in the early stage itself. Nowadays also maternal mortality and morbidity etc. reduced with these proper care. Then first week following the childbirth, that is also an important and special time. Especially she has to accept, or she has to physically and mentally, she has to accept that one she has to take care one more. For that, she needs the support of the people around her, that is her family and the healthcare workers. So she has to feed her properly. For that, her health should be improved. Her mental stress should be relieved after the delivery, etc. So adjusting her life with a new baby, actually that is a challenging one. But every mother in the world, or every even human, or every all the creatures, it's a accept these and take it as a challenge. Accept the babies. As for that, she needs care, support, and her all the windows should open. So these should not last, uh, uh, or it should last at least for 6 months. That is our maternity, our ruling government policies are maternity leaves, etc. So minimum of, we can say that she needs 6 months. So a biopsychosocial approach needed for her health and the health of the baby. So we all know that during the pregnancy, as I said, there are a lot of changes occur in the body uh, due to the changes of hormones. Or we can say that the dosha avastha, imbalances of the doshas, Panjabhaudika imbalances, as she after the conception, Shukra Shonida, Samyoja, and Atma Samyoja, there is a Panjabhaudika for different or other one more Panjabhaudika, Pinda or Kuman, whatever it is. One growth is growing, or one growth is in her body. So if something is inside, or some other her her resurrecta, or madhurja pidurja etc. bhavas, samyojya bhavas occurring or growing in the body, there are many changes occurs in the sodas dhadus that need occur, means that change is necessary for the growth of that Shukrashonida Atma Samyoja Bhavam for the nourishment, etc. So it has to be nourished. All the rasa bhavas, madra ahara rasam, should reach that Panjabhaudika Garbha, Atma, Shaddhadu, Purusha, or whatever we can say that. So that during in that change, Resadhadu is supplying to the Garbha through the Nadi. So due to that, she gets amenorrhea, Artava, the Ubadadu, not occurring, and she has due to the growth of that garba, she gets some amasya, pakwashya changes. At the same time, nadi, she her hridaya nadi, nabhi nadi is connected to her hridaya. She has got some Ucha Avajesh Bhava Shraddha Pranayam. She has some likes or dislikes. As Ayurveda says, the baby expresses or the fetus, Garbha expresses its wishes through the Indriyas, through the mother's Indriyas. So, lot of changes occurring in her body. Shvayathu, Normalaji, that is Vata, Pitta, Kapha, Doshas, some asantulita avastha, not some changes as the garbha growing, gurutvam in the body, and there is a pulsations in the vagina. So these changes will revert back, revert back just after the expulsion. That reversion or as the garbha expelled out after the period, after the 9 months, after or 10 months, as per Ayurveda, after the 37 weeks, uterus or the organ where the garbha grows comes back from 1000 grams to 60 grams. So we say that the uterus comes down with involution. So there is a normal process of involution, 2 centimeter per day. So after the delivery, so Kukshi Vriddhi occurring during pregnancy, Kukshi Hrasam occurring during postnatal period as the Garbha came out. So that Kukshi Hrasam is physiological and normal. But with our medications, with our care, we can help that action easy and smooth way. So at the end, after delivery, it is 20 weeks. I say it feels like a ball, but it comes down. It comes down, and it will become the pelvic organ. In cervix also there are changes occurring, vascularity, hyperplasia. So after delivery, that hypoplasia occurs. That is, dhadu vriddhi was there during the pregnancy. The dhadu kshayam or dhadu kshayam in a positive manner. That is, jaliya amsham reduces. Parthiva bhavam reduces. There was akashatvam during the pregnancy. As the space reduced or a space occupied by the garbha came down, Akashabhavam or Panchabhaudikatvam physiologically reduces. So due to that, there is hypotrophy, hypoplasia. All the cervix and vagina, all the organs came to the normal. Vagina by third week. So involution takes 4 to 8 weeks, but never come to the virgin state. Then after the expulsion of the placenta, the endometrium, there is the lining, lining of the endometrium, it's all shedding. The placental area starts to heal. So by that kledatvam, or we can say rekta kleda nisrudi, that is lock here. There is some discharges from the vagina. That is, first days it is like a red color, then the color little changes, rosa, and it become white. So by the 15th day, her body or the secretions reduces. Placental side starts to heal. If any infections, if any sodo dushti is is there, there will be change in the ganda, varna of the discharge. Then delay, cervical mucosa changes occurs delay in lactating mothers. And thickness of the fallopian tube and swelling, which were there previously during the pregnancy, reduces. And the pelvic muscles relax, slowly regain the tone by 6 to 7 weeks. Ligaments takes more time to recover. Ligaments takes more time. So we can by our treatments, by our snigdha procedures, we can make the recovery more faster, or we can boost the recovery, and even the pulse rate, gadi, because nadi gadi etc. changes due to pain and excitement, and the temperature should not be more than 37.2 degree. And usually it rise by 0.5 degree, and third day little bit rise. And urine, dilated ureter, renal pelvis will become normal by 8 weeks. Actually, trauma occurs during the labor. Trauma occurs anteriorly, posteriorly. Anteriorly bladder, posterior rectum anatomy. So in the bladder, bladder may be over distended. No desire to pass the urine also. So usually the oxytocin induction nowadays, oxytocin induction is induce the labor is necessary, or it's a part of labor, even the normal labor. So the side effects of the oxytocin also cause distended bladder. So usually after the labor, we see that the lady feels difficult in passing the urine because of the trauma to the nervous plexus. So that also, that is, as far as we concerned, it's a Vada Vriddhi. And there is increased thirst. So her fluid loss occurs, and the lochia, that is at discharge, diuresis, and perspiration. Diuresis occurs after some time, and perspiration due to the kleshatvam during the labor cause loss of fluid in her body, and intestinal paresis, that is progesterone reduced, estrogen increased. And also due to the pressure, constipation will be there, and the fluid loss, she has 2 kg reduction, usually 2-3 liters by 5 weeks. And the blood volume, that is a resakshayam occurs, blood volume decreases, and due to the pain and excitement and blood circulations, cardiac output rises. Then fibrinolytic activity reduces. Erythrocyte sedimentation rate will be high. So we can, there is an exhausting experiences. So we know that the Vada Vriddhi occurs during that Prasudi Maruda Klesh, Prasudi Maruda Vesi. The Maruda which is occurring during the Avi is Prasuda Maruda, Prasudi Maruda. That is, we can say that uterine contractions. So due to that contractions, the Braxton Hicks contractions. The contractions, it is like a wavery. So that wave, that pulsations increases during that time. So with that, she had get exhausted due to Pradada Vahana Sramam, and her Deha Shaidilyam occurs, Indriya Klandada occurs. So she is like a Sara Shunya Dhatu. So very difficult to clean the body, that is Klesheni Shodhate, Vyadhina Masaha. She can, we can compare her with a dismantled house, and when the small wind comes itself, it cannot withstand. So we have to take her like a Taila Patram. Garbadi it's like because the diseases which occurring on her may affect the baby and it is very kashtasadhi. So proper care is needed in terms of ahara, vihara and aushadha. So as I said, Vata dosha predominates after the delivery. So our aim is to Garbha, Vriddhi, Shedida, Sarva Sharira Dhatu Shidilada occurs, Pravahana Vedana occurs, Kleda Rekta Nisruddhi, Vishesha Shunya Shariram. So we have to make her Punar Navi Karudi. Already she is Navi, Punar Navi Karudi. Punar Navi Karanam. So her Agni again has to enter aggravated Vata to be removed and promote Stanya, support Dhatu regeneration, enhance strength and emotional stability. So, usually, generally, uh, during the postpartum period, we have to observe vaginal pain, bleeding, breastfeeding, then regarding the contraception, nutrition, exercise, then bladder, regarding the health of the bladder and bowel function, sexual relations, breast engorgement, and we have to educate the baby care, educate on baby care and regarding the immunization. And if the baby is a stillbirth, miscarriage, neonatal birth and cesarean delivery, we have to take special attention or special advice or special examinations to be conducted. So these are the components we have to look for while treating or while attending a Sudhika. So, as per Acharya, Charakacharya, etc., all the Acharyas mentioned that the food should start with light diet. We all know that Madha Vriddhi occurred during this period, so, and Agni will be Manda. Rasadhatu Kshayam occurs because from the Vriddhi, sudden Kshayam. Dhatu, Agni, etc., will be less. So we have to kindle Agni. So we should not give heavy diet. So from rice gruel, this peya and SP manda also, yavagu also mentioned by all the acharyas. But acharyas mentions that based on the desha, kula, then jadi, satmya, prakriti, based on that, we have to advise the ahara, vihara and aushadha. That is, we cannot give the lady delivered in the Kerala or in the Rajasthan or different state. Differs in the climate, differs in the her atmya, differs her customs, differs her family environment. Even in one state itself, it is unique. The treatment should be unique, but we should consider the basic principles because family to family, caste to caste, area to area differs. And these are doing Saudika Parjatya before itself that every home they they have some principles that we can justify with the scientific manners. So all the families, all the areas prefer Lekhu, Vranaropana, Aharas first itself. They'll give light diet. But nowadays, after the delivery, everybody will say that they have energy, can have the rice in Kerala, especially in Kerala. We'll say that in the hospital based, they have to take food. That is modern technology related hospital based. But at the same time, that time practically I'm saying that hospital based, that is not Ayurveda hospital based, modern hospital based. So that time they can give ginger and honey. Ginger, Ardraga Swarisaman with honey to improve the digestion just after the labor. So Abhyanga cannot be done. As Acharyas has mentioned that Abhyanga of abdomen with thyla, etc. The delivery occurring in the Ayurveda hospitals, we can conduct Abhyanga of abdomen with thylam, gridam, or just after the 5 days. Normally, 5 days it takes 5 days for the normal labor, or the day itself. Usually, some hospitals discharge. In other hospitals, if there is no complications at all, normal labor that day itself. So, Abhyanga with Tailagrida, then Udara Pattaveshtana. And usually in the Ayurveda hospital, delivery occur in the Ayurveda hospitals, few hospitals practice in that irrigation or bath with lukewarm water, even in the vagina itself. That is a good procedure so that we can prevent the Vada Vriddhi. Vada Vriddhi, and she can regain the energy. Then Sarpit Taila Vasamajja with Panchakola Churna. So Panchakolam has supports this autolysis and hypoplasia of the cells. Already hyperplastic cells, so that cells reduces. So that reduction in the cells supports involution of the uterus with Ushna Jala. That will increase the Agni also, Dhatu Agni and Jadra Agni. And we have to regain her uh, as per we have to regain her energy also. So after that after the this thing she became Acharya has mentioned Brahmana medicines, etc., Brahmana drugs. So first from the light diet, then to solid diet, heavy diet. Same mentioned by the Susuta, but Susuta Acharya has mentioned Gudodaga Panchagola. That is Rekta Kleda Nisudi. That Kleda should expel out. So that postpartum hemorrhage, postpartum bleeding can be prevented. That also supports the involution of uterus. Acharya mentioned the Abhyanga with Balathailam and irrigation with the irrigation of Padradaru. That should suppress the Vada. That is taking bath with Vadaharati. So these are the principles mentioned by Acharyas. So and even Acharya mentioned the Sneha Yavagu or Kshira Yavagu. So nowadays these are compensated with IV drip, etc., in the hospitals. So if this again I'm saying that hospital based thing, IV drip, at the same time the Kshira Yavagu, etc., can be given first day itself or evening. First day morning Panchagola with a good Akshiram, and in the evening itself Kshira Yavagu can be started. Acharya has mentioned third day, fourth day, etc. Mainly this third day, fourth day, why it is mentioned is breast milk secretion starts. And she has to feed, she has to regain. So again, her Brahmaniya drugs, Mam Sarasa with the Jangala, uh, soup, mamsa with kola and kulatha, cooked with shali rice. So Sudhacharya has mentioned seventh day or eighth day, rice can be started. So in general, we can say that first gruel, then slowly to the after the peristalsis regains of intestines regains slowly to the solid diet, from the liquid diet to solid diet. Then even even Ashtanga, Sangraha, everywhere mentioned that from till 12th day it is mentioned. So Mamsa Rasa only after 12th day. Can be due to that, due to the socio-economic, social atmosphere during that time, or Mamsa Rasa is difficult to digest. So only after 12th day. That also we can justify 12th day Mamsarasa use. And again, Yamaga, Abhyangam with Taila Grida is mentioned. So that improves the uh, maintain the body heat, and she get support to the abdominal muscles than single Snigdha Taila. For that, here in Kerala and all, we prepare Dhanvandaram Kulamba, that is Thaila, Grida, Kshiram, etc. mixing. So, with all the sneha, will give much strength to the body. Again, Panchakola is mentioned, and the days are differs with the acharyas, maybe differ in their uh, desha, etc. There is difference. Again, Ashtanga, they are also. But especially in Ashtanga, it is mentioned that yoni pidhanam, massaging the yoni is mentioned. Everywhere mentioned Ushnodaga, Jagari water, Pippali, Panjakola, Kashiba also. So all the areas, Nagaram, Pippali. So again, Kashiba says Alpa Sneha Yuktam. If Sneha enters, or Jangala Desham, etc. Based on the Desha, Kashiba mentioned. So Sneham. First start with Alpa Sneham, then increase the Sneham. Signat, because at the first stage, even the normal labor, little bit kledatto or amatto may be there. So Alpa Balam. So if Sneha gives, again Amattam increases. So Alpa Sneham increase the Agni slowly, then after the increasing of the Agni, Sa Sneham. And Levanam, it should not increase the Kledam. Then Amlayuktam. Amlayuktam for improving the Purisha, Vada, Anilomanam. And Grida Brishta Kushmandam, Mulagam, etc. That may be available during that, or mostly available around that area, because Kashmiri people use dry fruits more, but seashore area people use some seafoods, or some area which more available vegetables they use more available. So wherever or based on the resources Acharya might have mentioned, but the basic principle is from the snigdha, from the light diet to solid diet, then at the same time Dibana Bhajana to Brahmana, slowly improving the energy. So at first Lenghana process we can say, then to Brahmana. Kashiba mentioned, Acharya mentioned that back oil massage not only over the abdomen but also on the back, flanks, etc. In special chair is mentioned that we can use practically nowadays sitting over a small chair to improve the strength of the pelvic muscles. So that filled with a hot balatayam, and at the same time it is protecting the yoni with priyangu, pinda. Even navara pindam can be used for the svedana. That is sneha svedam. Svedanam using Priyangu Pindam, even Tila Pindam, Navara, Shashtiga Pindam, etc. we can use. Then after that, hot water bath, and she has to take rest and fumigation. That is another speciality of Kashyapa Samhita, that fumigation is mentioned. So she we can consider as Vrani. So Vranidagara, the Vrana Roga Adhyaya, etc. Vranita Roga, Vranita area, etc. We should fumigate to remove the all the bacteria or any crimi, etc. Make the atmosphere sterile for the baby and for the mother. Because especially during the cesarean or nowadays episiotomy wound, so we should consider as a granita. So fumigation improves the wound healing also. And manda is mentioned for 3 to 5 days. That's why I said from the light diet to the odana. Snehapanam according to Satmya. Anupadesham avoid fat, manda with Dibana Bhajana drugs, and Sweda Nivada Shayanam. Acharya Kashyapa mentioned Desha, Kula, etc. based treatment. Then wherever then he has mentioned Vishesham, Kandam, Moolam, etc. mentioned. From that we can assume that wherever, whatever Satmya to a lady, even she is a Kandamula Satmya, if she is not taking Mamsarasa or whatever Satmya to the lady should be given. And Rekta, etc. to be given, it is mentioned. But if there is any blood loss, blood transfusion can be done. Then again he has mentioned that Kumari Prasave Thailam Kumara Gridam. That also can be practiced. Thailam Twak Varnam. That is also can be availability, or that Kumari Tilam will be more good for the skin and hair growth, etc. Vata Pitta Haram, Kumara Gridam Vata Kapaharam. Harida also mentioned with Panjavola. Chadurjada is specially mentioned. Methika, Chandrashura, Kalaja, Jivani. So all are Agnidipana, Mapajana. Then fifth day only Shali Shashtikam, that is Ordinary. Continue 10 to or 15 days. And she should meet only on 12th day meet other women. So that also says that she needs rest till 12 days. On 12th day only, Sudhigottanam it is mentioned. So at least she should take rest. She should reduce her motor activity. But to prevent thrombosis, etc., she should move her body, etc. Move her hands, fingers. But the day itself she has to, but she needs rest till 12th day. Uniprepedanam just after the labor to be done. So uniprepedanam, that is priyangu, etc. Pindam can be used for swedanam, etc. to avoid the entry of the water. So whatever the procedures to prevent vada vriddhi should be done. That is why Bhakti mentioned that Sveda Abhyangam to be done. It is improve the, reduce the vada and all the doshas to be in the making in the normal state. Na ekantatva. She should not be isolated because she is with the baby, and sometimes she should be, or we should be vigilant. She should be observed. She should under observation at least 15 days because there are a lot of complications occurring during this time. That is why wait for 12 days, Sodhigottanam, Snanam, Dukkhashilaha, Savadahara, Padita Jala, Madahara Jala, Patra Jala, Padita Jala, Vela, Nargunda. In Kerala it says Vedukuli, etc. But nowadays it changed to Twak Varnya related drugs, that is Nalpamara, etc. Madahara, even this um, jackfruit leaf and all used. So remove the dukkha, snanam is needed. Even simple ushnodagam, prabhuda ushnodaga snanam is needed for rekta kleda removal. And abhyanga increases the circulation and stimulates the sensory receptors. At the same time, serotonin, dopamine, oxytocin level increases, cortisol level decreases, yamaga abhyanga regain the tone and strength. So we have noticed that those who are coming in Ayurveda hospitals for the back pain or other vada vyadhi, after taking a survey that she might have not done her proper postnatal care. That is after delivery, she has not taken any rest and all, and abhyanga, swega, etc. Have not done. So in future, that will usually during the Jara stage, Vadavyadi, chances of Vadavyadi, but those who have not taken postnatal care, there are chances of early occurrence of Vadavyadi. And Kashyap also mentioned the Dobanam. Dobanam in the room itself, at the same time, Dobanam to the vagina. Make helps to tighten her muscles and it reduces the vaginal discharge, antimicrobial action, and prevents infection. Helps to constrict the muscle fibers so that in future we can prevent the prolapse of the uterus, prolapse of the pelvic organs. Due to the prasudamaruga, kleshatvam, there are chances of uh, mm, this one uterus comes down or prolapse or bladder comes down. So to prevent that, dubanam and even that yoni prapedanam, yoni abhyangam, etc. necessary. And udarapattaveshtanam. Udarapattaveshtanam also prevent the uterine prolapse or umbilical hernia. So we have seen that those who have delivered 2, 3 lower segment cesarean section, not taken proper postnatal care, especially Udarapataveshtanam, the ligaments laxity of the muscles occurs. So abdominal binders support the muscles only after applying the yamaga or vadahara tatra kalka also we can apply over that. After application of Yamaga, Vadahara, that is not mentioned by the Acharya, but in practice, we can use Vadahara Patrakalka and abdominal binder for some time. But if we use it more time, sweating occurs, there is sweat related infections may come. Even post cesarean section also, uh, not tight abdominal binders, loose abdominal binders is helpful for walking. Lady support improves her walking function. Anyavago, Mamsarasa, Grida, all are Pranadharana, Vadapittahara, and Tarpana, Grahi, Hridyanilomana. And Grida, Snigdha, Guru, Madhura, Vadahara, Savardhaka. These all are should be given to the lady in the first, at least first 1 to 12 days. And it should be continued up to 4 months. And Pipali Moolam in butter for 21 days for reducing it, because after the delivery, majority concern regarding the cook sheet. If in a sub-involution occurs, if proper support is not given. So Pipali Moolam in buttermilk, 21 days, reduces the cook sheet. And Yoni Gadi Karanam, and for Vanaromanam, Palashodumbaram with Tilatailam and honey. Perennial tears occurs and laxity of that vaginal mucosa. So that can be prevented by applying Palashodumbar, Tilatailam and honey. So most of the drugs, that is Chadurjadam, Panchakolam, even Jeeragam, aid digestion and lactation. And gradual diet progression with Vada Shamana foods like to Manda, Peya, Yevagu. And Mahaprakash mentions many, most of the Akrita Anna Varga, which are using in all over India. There is slight differences in the name and all. I think we can refer, most of the Ayurveda physicians can refer Kridana Varga of Mahaprakash. Because many varieties of foods, which is that is a for modifications nowadays, even the biryani, fried rice, etc. It's a modified varieties, which is already mentioned in the Mahaprakash. Dali, Delida, Dal. It's mentioned as Dal. Levanardraga Hingu. And if we add cereals in that, super. And if Tandula is added, Krisara, Tabahari, rather Kridana Varga, it's mentioned, Kridana, Anna is mentioned, the Grida Bajjida, Haridra, Masha, and add water, salt, ardaga, and make it boil. So all the Dibana Bhajana drugs with the masha, wheat, even rice, different varieties of foods can be prepared based on the Satmya, Agni of the lady, and based on the availability in that area, and based on the family custom, past, and Satmya, and season. Pujiga, Vadaga, Yevarotiga, Galam. Kerala, we give that previous days and nowadays also. Different area, different people follow different varieties of or different method or different food items. Among that buttermilk, boil the buttermilk with haridra, then tilabarjidam or gridabarjida, ardraga, levana, maricha, even dhanyaka. So it looks like a yellow color buttermilk. Then after bharjana, we boil, little bit boil, and that is used for drinking and for like rice with peya, buttermilk as peya, or little less tandula and more buttermilk. So first, that is for Vranarobana. For first few days, people give only without any dishes, only that buttermilk. So these preparations are mentioned in the Mahapragashana. It's Evika, Modaga, Shashkuli. Kundalini, Narikela Kshirika. That is, Narikela grated in the Kshira, make, make a porridge like. And Amra Balavarega. So many varieties. Most of them are Agdidipna, Ripchya. So these can be given for the Sodhika based on her Agni after few days, especially after 12 days. Improve her or like a prenana. And these all can improve the lactation also. So basic principles we have to consider while treating a Sodhika. So Garbhani Sodhika Bala Vridhan Brahmaniya. So she is indicated for Brahmaniya only. So how it is should be Brahmana to be done? Mamsa Kshira Siddha Sarpi Madhura Snigdha Vastibihi. So Vasti it's contraindicated. Astabhana Vasti is contraindicated. In case of emergency, Anivasana Vasti only. That is after few days only. Swapna Shayya Sukha Abhyanga Snana Nivritti Harshanaihi Harshayet. She should be Harshayet, mental. Because this is the time for postpartum depression, postpartum blues. Because it's a challenging, she has to accept the new atmosphere. So that acceptance may differs based on the sattva. So we have to improve the sattva with ahara and even yoga, pranayama, and few yogasanas which can be done. Those who are in practice, those who are doing yoga in old days or it's in practice, she is habituated doing yoga, she can do. Or if they are doing first itself, she should do under the guidance of somebody or she should start with simple asanas. Shutrishna Nigrahehi Samiranadabayasehi. That should be avoided. Bhimmestu Mrudulangayet, Mrudulanganam, that is starting light foods, Mrudulanganam, or Dhiman drugs. Yuktya Deshakala Balasta Anupaja Pajaret, Brimhide Syad Balam, Pushti, Tad Sadhyamaya Samksheha. She will get immunity, immune. Diseases can be prevented. Mando Vadanulomanaha. So Vadanulomana. So Vanda should started with Manda, Trid, Glani, Tandra, Dosha Sheshagnaha, Pajanam, Dadu Satmekrit, Chutrikshna Agnibalai, Daurbalya, Kukshi Yoga Jirapaha. So we can treat with Manda. We can give her Manda. Start with Manda. Malanilomini, Pathya, Peya, Divanavajani, so Peya. Brahmana, Prenano, Vrishya, Chachusho, Vranapaharasaha, Mudgarisam. Mudgarisam. So Mudgarisam can be given to the lady. Kaulatham, Kulatharasam. Kulatharasam means starting. First, Vada Anulomanam. So starting with Anulomanam. Divanavajanam. Because Gulma, Tuni, Praduni, Nijit, Praduni, Jit. That is Makkalla. Makkalla is after pains due to the Shesha Dosha Rektam. If the Shesha means not, Kledam is not, Rekta Kledam, or Shesha Dosham is accumulated in the uterus. It may lead to Makkalla Shulam and Gulma and Vidradi. So to prevent that, Kaulathayusham can be given in the first days. Matsyam actually the Acharya is contraindicated in the first days. On 15th date only, Mamsa, Matsya, Mamsa, Hara starting because it's Kapakara. Na Adishida, Guru Snigdha, Mamsam, Aja Mamsam. Because Sharira Dhadu Satmya Anabhishyandi Brahmanam. So Mamsaras, Aja Mamsam may be more better than other Mamsa. Usually we can give Dashamulakwada, Jiragadilihya, Shadavari Kalpa, Phalakrida, even Jiraga Arishta, Saubhagishundi, Modaga, Sahajradi Kashaya, Kshirabala Taila, Panjajiragahuda. So based on the availability, based on the Sharira, based on the Agni of the Sudhiga, medicines can be decided. But better, first the medicine which can expel the doshas, especially Arishtasava or any Paniya, this Panchagola with Gudodaga, then Arishtasava. Then after that only Rekta, Doshaharam, Kashayam, and then Brahmaniya Kashaya or Brahmaniya Lehya, Brahmaniya other medicines. So Abhyanga, Mridusweda, Yoni Prakshalana, Vasti, emotional rest and family support. This is a must. Nasyam, Astabanam, Krodayasam, Ratri Jagaranam. It will affect the baby and the mother, the health of the mother. So Agala Prasava, Dushprajada, Mudhagarbha like we have to treat. So Snehapanam, in Kala Prasava, Akala Prasavam Langanam starting. Then slowly Prenanam, Kshiram, Mamsarasam, then Svedabhyanga, Pijuvasti, etc. So 4 months, it is mentioned in Mudagarbha 4 months. So Dushprajada or Akala Prasava, how many days she has got Garbhasrava, how many days? 6 days, 6 months, 6 days. Yavagu. After that, normal treatment. She should be treated with light diet. With how many days she has conceived, how many months she has conceived, that days. So postnatal period, as per WHO, birth to 6 weeks. So recovery, as we said, that recovery can be done with our basic principles: lactation, family planning, complication prevention. That is physical, nutritional, psychological, and social well-being. So monitor her bleeding, BP, infection, uterine involution, and she should be provided with high protein diet. That is our cereals, Yavagu, Manda, Peya, whatever the Bhava Prakasha, Kridannavaga mentioned. Screen for the postpartum depression, counsel her for in lactation, lactation initiation is needed, and counseling is needed properly. So Ayurveda, Dhatu, Satmyam, Agni, improving as per model. So Dhatu Satmyam means anatomy, physiological changes reverting back. Evidence-based clinical monitoring is needed. So our goal, same goal, different path. Healthy mother, healthy infant. So 1,000 days nutrition is the dietary requirement. That is 270 days during the pregnancy, then 365. That is till 2 year childbirth. She should be given proper nutrition because she is a lactating lady. Extra calories is needed with the cereals, animal sources, legumes, pulses, nuts, vegetables, fruits, tubers in a balanced manner. At least every day. she should consume 4 out of 6 food groups to meet their nutrition need. So, an integrative approach is necessary for the health of the mother and baby, the yoga and pranayama for the emotional balance. Yoga and pranayama can be done, especially Nadi Shodhana pranayama, Brahmari pranayama. She can practice from the first day itself. And with the support of the pillows, etc., she can do small Merugandasana, Utkadasana, slight changes with Pavanam, not complete bending and all. If the normal, if it is normal delivery means Pavanamuktasana and see in and out exercises, Ardha Gadiya Chakrasana. That is, but it should be under supervision or if any instructions needed means somebody can give and she can practice. So many researchers has done with the Dashamula, Panchagola, Panchajiraka Guda, even Shadavari. Many trials have conducted. These medicines have improved. Ayurveda Sudhita Paricharya has improved. Better uterine evolution, lactation, and improve the Agni and Dhatu Bala. So that in future, her gynecological disorders like uterine prolapse, and she can prevent them, or she can live with better menopausal period. And so, still, it is very difficult to standardize because desha difference is there. But still, to some extent, standardization, the basic principles we can do. And if there is interdisciplinary support is there, we can improve or we can make it globally accepted basic principles. Because the practicing, the food practicing here may not be practicing in Italy or in the or any other area in Europe or Asia or Asian other areas. But the basic thing we can propagate. We can share common objectives. So it can enhance the maternal outcome, healthy mother, healthy family, and healthy society. So we can globally we can announce that as per Ayurveda, a postnatal lady should start with a light diet, whatever available in her area, and tail application, abhyanga, snigdha, or use of snigdha or use of ruksha based on the desha. Then proper rest and proper support for organs, especially Udarapataveshtana, and care should be given for her or external genitalia. So, with the basic principles of Ayurveda, we can standardize. Instead of standardization of the drugs or standardization of the ahara, basic principles can be standardized because we are following different acharyas has mentioned the principle same, but still there are some differences. So from the manda to odana, and from the agni to brahmana. So these things we can make globally, and each physician can think over regarding these basic principles and advise the medicines and food. With this, my session is over. Any questions? questions or any discussions, we can discuss.
Thank you, Dr. Yamuna. Thank you very much. I am confident that our YouTube viewers will be definitely benefited with this your Sutika Paracharya episode. Dr. Kiran is with us. Whether Dr. Kiran would like to add something or ask anything? Dr. Kiran, Dr. Kiran, am I audible to you? I am confident there is
It's a 9:20.
nothing left. Yes, great. Nothing. You have explained each and everything in detail. Great, great. Artya Puri
Sadadadyayavada.
Dosare. Sonur is in
Sadadadyayavada.
Karnataka.
No, sir, I'm Kerala.
Oh, you are in Kerala, Malayalam. Great, great, great. In our college also, I am from Mansarovar Global University.
Okay, sir.
Aarti is there from
Um,
Kollam,
oh,
Aarti Prabha.
um,
So welcome on the platform. Thank you.
thank you, sir.
Thank you very much.
Okay.
Please circulate the YouTube links to the
Yes.
concerned person.
Okay,
I
sir.
have given link address in this chat box.
Yes, sir.
So please circulate it. Thank you. Our next webinar is on polio. After 10 minutes, we will be conducting next webinar on
Okay,
polio.
sir.